Dr. Mangesh Munde, Professor and HOD, Prasuti Tantra Srirog Department and Organizing Secretary of these events. A very warm welcome to all of you for the national webinar on female infertility and Garbhasanskar organized by our principal sir and Prasuti Tantra Srirog Department, Dhanvantari Ayurveda Medical College and Charitable Hospital, Udgir. So, first of all, I heartily welcome our guest, Dr. Satish Dumbre, sir, who is ex-faculty dean, Ayurveda faculty, MHS Nasik, also running faculty member of MHS Nasik. Sir is principal at Astang Ayurveda Mahavidyalaya, Pune, also very good physician with skillful personality. Sir published various scientific papers at national and international level. Our second guest is Dr. Ajit Gopchade, sir, who is the Vice President of Maharashtra Medical Council, also member of Management Council of MHS Nasik. Sir is the President of BJP Medical Cell of Maharashtra State. Sir is also well-known physician, pediatrician at Nanded. Completed UG and PG from Government Medical College, Aurangabad. Sir performed emphatic work through MARD, also member of various social and educational associations. I also welcome our speaker and chairperson today. I would like to welcome to the expert speaker of this webinar, Dr. Mandar Ranade, sir, consulting gynecologist and obstetrician, Pune. Second, that is Dr. Gauri Ganpate, Madam, Associate Professor in Prasuti Tantra Srirog Department, SGM, Ayurveda Medical College and Hospital, Gadhinglas. I also welcome the chairperson of this webinar, Dr. Jaimala Sirke, Madam, who is the principal of MS Ayurveda Medical College, Gondia, and Dr. Rujita Dube, Madam, Professor and HOD, Prasuti Tantra Srirog Department and SNKD Ayurveda College, Nala Sopara. Let us start the webinar with Dhanvantari Pujan and Vandan. I request our beloved principal, Dr. Datta Patil, sir, Dhanvantari Ayurveda Medical College and Hospital, Udgir, for Dhanvantari Pujan. Thank you, Principal, sir. After that, I request Dr. Satish Dumbre, sir, for inaugural speech.
Madam,
Dr. Satish Dumbre, sir, faculty dean, Ayurveda faculty. I request Dr. Satish Dumbre, sir, for inaugural speech. Please start the speech, sir.
हॅलो, डुमरे सर, आवाज येत नाहीये. हॅलो.
Hello, Dumre sir, please unmute me.
We are also celebrate the birth anniversary of Samuel Hanuman, father of homeopathy. Today, I request Dr. Patil sir. Madam, तुम्ही बसा. Start.
आता स्टार्ट करते सेशन फर्स्ट. व्हिडिओ पण शेअर करते आता.
सर ऍड्रेस तुमचा लगेच घेतो का?
सर तुम्ही कनेक्ट होत नाही, तुम्ही डायरेक्टली करा.
तुम्हीच घ्या की.
सर
नंतर सगळं.
सर तुमचं स्पीच
सर तुमचं घ्या की.
पाहू देतो. ठीक आहे.
Now I will like to request Dr. Rashmi Chidre Madam, Assistant Professor in Prasuti Tantra Department, to continue first session. Dr. Rashmi Chidre Madam.
Good afternoon, one and all. Myself, Dr. Rashmi Chidre, lecturer, PTSR Department, Dhanvantari Ayurveda Mahavidyalaya, Udgir. So let's start the first session with the introduction of our chairperson, Honorable Dr. Jaimala Shirke ma'am. Once again, a warm welcome, ma'am. She is the principal at MS Ayurvedic Medical College, Gondia, since 9 years. She has completed her UG from Ashtang Ayurved College, Pune, and PG from Tilak Ayurved College, Pune, in Prasuti Tantra Evam Stri Roga. Ma'am has 30 years of teaching experience. She is an author of 3 books, namely Prasuti Tantra, Stri Roga, and Practical PTSR, published by the Tathagat Publications, Pune. She has worked as an examiner in various universities, MHS Nasik, Pune University, Shivaji University Kolhapur, and Goa University. She has attended various state level, national level, and international level seminars and webinars. She has a very good clinical experience in diagnosis various patients of Stri Rog and infertility with Ayurvedic diagnostic approach, and also treated them with Ayurvedic therapies and Panchkarma. She is expert in managing ANC patients with Garbhini Paricharya for Suprasava, and also published scientific papers in various publications. Our first session will be delivered by Dr. Mandar Ranade sir on the topic of an integrative approach towards female infertility. Dr. Mandar Ranade sir is well-known gynecologist and obstetrician at Pune. Sir has completed his UG from Tilak Ayurveda Mahavidyalaya, Pune, and PG from Ashtang Ayurveda Mahavidyalaya, Pune. He also holds additional qualification of LLB and LLM. He presented a scientific paper at International Conference USA on the topic Contribution of Indian System of Medicines to Obstetrics. Active participation in various state level, national level, and international level conferences. He has received master training for capacity building of safe deliveries. He has given surveys in rural and remote areas at the time of natural disasters. Now, I would like to request Dr. Mandar Ranade sir to deliver a lecture. Dr. Ranade sir. Once again, I request Dr. Ranade sir to start your lecture.
Hello, am I audible?
Yes, sir. Please
Uh,
continue.
Yes. It's visible. My PowerPoint presentation. Introduction part.
So little bit disturbances is there.
Your voice is audible.
Okay, sir. Please share your PPT so that
Yes.
you can start your lecture.
Introduction has been done or not?
Yes, sir. Yes, sir. It is done.
Where's my face? Okay, at the outset, I would like to thank my friend Dr. Datta Patil, who is the principal of this college, Dr. Munde, who is the HOD, and all other dignitaries who have taken a lot of efforts for arrangement of this particular webinar. Today's chairperson, Dr. Shirke Madam, is also my guru, teacher. So I would like to express my gratitude, thanks to her also. The topic is, next slide, please. The topic is integrated approach towards female infertility. Now, I have tried to encompass this particular huge topic in a few slides, because I have to complete the Ayurvedic part as well as the modern medicine part. Now, there are different definitions which are there in Ayurveda about this particular infertility, Vandhyatva, and it is the lady who has lost her menstruation, or a lady who has lost her capacity of ovulation, that is Artav, or that is Nashtartava, it is called as. And Vagbhata says that is congenital underdevelopment of the female genital tract, while Bhel Samhita says about the Vata dosha which has vitiated, and because of that, this infertility occurs. Summarily, Vandhyatva can be defined as a woman who has lost her capacity of healthy menstruation as well as ovulation, and leading to loss of the fertility. Now, it's a very beautiful differentiation by different acharyas in Ayurveda about female infertility, that they have described it as Nashtartava, that who has lost her capacity of ovulation. Vagbhata says about congenital abnormality. And there are different description by the Harin Samhita and Bhel Samhita also. Now, considering the etiology of female infertility, we have to have the damage to Artava Srotasa, because there are Viddha Lakshana. If you have a trauma to different Srotasa, there are Viddha Lakshana described by Sushruta. And Artava Srotasa, if it is Viddha, that is traumatized, then we can have dyspareunia as well as amenorrhea, leading to infertility. Now, ladies who don't have proper diet and behavior, which is described in our granthas, then disease of the Artava, then intercourse with the girl before menarche and during pregnancy, and disease of the genital tract are described as the positive factors of the infertility. Different types of factors of conception, disorders of the different types of conception. For that purpose, we have to have understood in your menstrual cycle, that is Raja Pravrutti. That is, one is Rutu Kal, second is Ruta Vetita Kal, and then third is Rajak Kal. Now, Rutu Kal is then definitely this particular conception occurs. So Rutukal is a kapha dominant period, and if Pitta or Vata dosh affects on this particular period, then definitely there can be disorders. If Pitta occurs, then there can be abortions, hemorrhages. If Vata is there, then Vata is vitiated, then definitely there can be infertility, because the proper Rutukala is not achieved and kapha is disturbed. So there are some kshetra disorder. Kshetra is the structure or the tract of the female genital tract, and it is we can have different disorders, structural disorders of the cervix and uterus. And Ambu is liquor. So whenever there are some disorders with the liquor, there can be problem with the premature preterm labor, and there can be relative infertility. Bhel Samhita describes the disorders of the ovum and sperm, that is of the bija. Now, Yoni Apad is also one of the important factor of the infertility. Yoni is a Travarta Yoni, having the three valves, which can be called as uterus, cervix, and vagina in the day-to-day modern scientific medicine, because there are three valves. It is described in Ayurveda. Vapad is a disorder, or is a threat, or is a damage. Therefore, different types of 20 Yoni Vapad are explained in Ayurveda, and out of which we can summarize, we can correlate easily with the many day-to-day modern medicine disorders. It is a beauty of the infertility in Ayurveda that many of the things which are found today are being properly described in Sushruta Samhita, Charak Samhita, and Vagbhat Samhita. There is no other description required. They are in verbatim same. The etiology or the symptoms and signs and the treatment aspect is same. So which disorders which we get today, signs and some symptoms which we get today have been properly described in the form of some diseases or in the form of some group of symptoms, which is we called as Vyadhi Sankar or a Vyadhi. So one of the important is the Asruja Lohitakshara. That is, Asruja means hemorrhagic, tendency of bleeding. Whenever there is early pregnancy or there is luteal phase defect, abortions in the early secretory phase, or unexplained fertility loss, or blighted ovum, or missed abortion, they can be all categorized in the form of this Asruja or Lohitakshara. Then second is Arajaska Lohitakshaya. Lohitakshaya, Kshaya is decrease, depletion. Lohita is blood. So wherever there is less amount of blood in the body due to anemia or this thing, then there can be atrophic endometrium. The endometrium can be atrophic, it will not develop properly, and therefore there can be amenorrhea, hypomenorrhea, or there can be infertility arising out of this particular not properly developed endometrium. Then next is Acharana, where there is infective discharge. We know that in many of the cases there is premature rupture of membrane, PROM, or patient gets abortions in the second trimester, or in early third trimester there is irritable uterus, and then patient delivers a dead baby, or it is stillbirth. Disorders is the vaginal infection. And Aticharana Yoni Vapar, which is described in Ayurveda by Sushruta Samhita and Charak Samhita, is having different vaginal discharge. And because of that, the pH changes, and it can lead to relative infertility as far as recurrent abortions and PROM and all these things are concerned, or infertility whenever there is different in the pH of the vagina. Because pH of the vagina is made acidic, as whenever the semen enters in the vagina for posterior fornix during intercourse, the pH of the semen is basic, and it is in the clump format. So vaginal pH is acidic, therefore it doesn't cause any effect on that. because of the it is not liquefied properly. And then whenever it is liquefied, it is sucked by the cervix, and then the further course of the spermatozoa occurs. Now here, if you see, if the vaginal pH changes, then there can be effect on the semen whenever it is shed in the posterior fornix only. And therefore, the amount of the spermatozoa which enter inside the uterus and the cavity will decrease, and therefore it can cause infertility. Similarly, the maintenance of the proper vaginal pH is also to reduce the entry of the microorganism inside the vagina, and therefore preventing the ascending infections. So this particular acharya yoni can be compared with vaginal discharges and infections, where this particular hampering with the spermatozoa mechanism, as well as causing premature rupture of membranes and IUDs also. Now, second, one more type of this particular yoni vapor is Shandhi or Shushka, where actually Shandhi is Shandhi infertility is where you don't have any, you either have some primary characters or secondary characters are absent, or somewhere there is infantile uterus or streak gonads, ovaries are not properly seen like that, so they are not functioning properly. So that is Shandhi yoni vapor. Or Shushka is where there is dry vagina or atropic endometrium, or the size of the uterus is also reduced. Now, Paripluta is again a abnormal hemorrhagic yoni vapor, where you have recurrent fetal losses, recurrent hemorrhages, and leading to secondary infertility. Suchimukhi is actually a pinhole cervix, which is found in many cases in our day-to-day practice, where cervix, and then only the fertilization occurs. It is a congenital cervical stenosis also, or congenital malformation of the cervix, which can lead to the infertility, primary infertility. So Sushil Samhita has properly explained this particular yoni vapor, which leads to primary infertility. One more is Antarbukhi, where you have a comparison with the day-to-day practices, retroverted retroverted uterus. In retroverted, what happens? Usually, during intercourse, the semen is shed off in the posterior fornix. The cervix remains above. The uterus remains in the behind posterior part, and therefore there is failure of spermatozoa reaching the cervix, and then therefore reaching the fallopian tubes, and therefore the infertility occurs. So for this particular, also Sushruta has properly explained this particular form of yoni vapor, and therefore we can easily correlate these things to the modern day-to-day period. Next aspect is a lot of conditions have been explained as Putragni yoni vapor. Putra is not only a son, is also a daughter. It means a fetus. Someone can say that Ayurveda is gender bias. It's not like that. So Putragni yoni vapor is where there is stillbirth, there is intrauterine deaths, or there can be premature rupture of membranes, and the fetus can die outside, or there can be neonatal deaths like that. So whenever it is Vata dosha is responsible for this particular yoni vapor, and Ruksha, due to its Ruksha guna and Dushta Rakta, this particular Putragni yoni vapor is generated, and we see in a lot of cases day to day also, because of some congenital problems, consanguinity, or due to infections, or due to many other reasons, this particular fetal loss.
Hello. Hello. Sir, your voice is not audible.
But Vamini is concerned with, so we can say like that.
Sir, now you are audible, but PPT is stopped.
Okay. Just a second.
Yes, sir.
Yes, started?
Yes, sir. Yes, sir. Please proceed.
Yes, sir. So I am at Vamini Yoni method, where actually due to incompetent os, the lumen of the cervix is dilated, and therefore we get recurrent or habitual abortions, where we perform this McDonald operation or Shirodkar stitch, where we reduce the size of the lumen, and we try to protect the pregnancy. Now, if it is during pregnancy, we try to do this, but if there is habitual abortion during pregnancy also, if we do cervical encerclage, sometimes there is cervical encerclage failure. That time now we have identified Shirodkar procedure, Shirodkar stitch, which can be done vaginally as well as abdominally. Nowadays we are performing it laparoscopically also with the help of Marcelin tape. We are doing it now. Day-to-day practices now. The recent advance is we are performing laparoscopic os tightening, laparoscopic encerclage during pregnant uterus also, during pregnancy also. So that can be comfortably done. This is recent new advance. So the conceptual etiological finding or conceptual signs and symptoms of social samhita of Vamini are today also found, and now we have gone ahead. They were using only kalkas and pichus, but definitely we are now using these methods of advanced os tightening and encerclage for betterment of this particular type of infertility, which is a relative type of infertility. Now, one more is there are some sthanik doshas which are told in Ayurveda manuscripts, are like yoni arbuda, which is a hard structure. Then there can be arsha, which is a polypoid structure, which comes out of the cervix. Maybe its origin is endometrium, or sometimes it is hanging in the vagina and coming out of the cervix. Recently, only for infertility patient, we have removed a huge cervical polyp, actually, which is now hopefully the patient can get the results out of that. Now, there are some general conditions. These were some conditions restricted to the yoni vapor or restricted to the sthanic or local conditions. Now, generalized condition, they have told about Rajayakshma, previously tuberculosis. It was once upon a time a deadly disorder, and preferably genital tuberculosis, which is also day-to-day life. Also, genital tuberculosis is very difficult to diagnose and difficult to treat because it is we can say there is some systemic disorder and it is transferred as a genital, or if it is a primary genital tuberculosis, it's very difficult to treat, and one of the important reason etiological factor of primary infertility. Shosh is drying up of the body. One more form of the Rajayakshma. Majjaksha is Majja is the important dhatu which is described in Ayurveda, which leads to formation of Shukra. So Shukra is responsible for the proper development of the both Stri Bija and Purush Bija, and in this particular presentation, Stri Bija. So Shukra is also important. So Majjaksha is also related with the formation of the or impairment of the fertility, that is infertility. Disorders of the physiological conception, Ayurveda Social Samhita has described about different disorders of the Maithuna, that is Maithuna, Sahatva, dyspareunia, Anichcha, frigidity, and asamyak, that is improper. So this is also found in day-to-day practice. Whenever we have to evaluate a fertility case or infertility case, we have to take the proper history of the intercourse, and we surprisingly find many things where actually they are not being trained properly of this particular art of intercourse, and therefore there is failure of ejaculation properly in the posterior fornix, or there is frigidity which is out of different mental or other aspects also from the female part also, and therefore if this is properly treated, then the pregnancy can be achieved or fertility can be achieved. Now, treatment from perspective of Ayurveda, basically as a Kaya Chikitsa perspective or a Ayurveda perspective, we know that it is Sankshepata Kriya Yoga Nidana Parivarjana. Basically, Kriya Yoga means doing the thing which is other than the causative factor, which is opposite of the causative factor. If a thing has been caused by Ruksha Guna, we have to give Snigdha Guna. If it is caused by Ushna, that is hot, we have to give Shita, that is cold part. Cold aspect of that. So we Kriya Yoga, whatever the ahar and vihar of the particular lady which is undergoing this particular menace of the infertility, we have to change that to opposite format. We have to treat with the opposite format, and then this can be achieved. Now, Nidana Parijana is removal of avoiding the causative factor. For example, there is tubal block. If there is some granthi arbuda, that is some hard structure, polypoid structure, we have to remove that. If there is now, there are huge number of huge number of kalpas are also described, but correction of the vata dosha, that is virechan and basti, which is also described. Snehana, abhyantara and internal and external, massage and internal snehan is also grutapan, and all these things are explained. Then Shodhana, that is Panchakarma, we have in Atulya Gotriya Adhyay, that is chapter of Atulya Gotriya in Charak Samhita. It is referred that whenever he is going for a pregnancy, actually he should be Shuddha, he should do proper Shuddhikaran, Bija Shuddhi, with the help of Panchakarma. And then only after taking proper Vajikarana, that is aphrodisiac drugs, the couple should go for the pregnancy. So if this particular Bija Shuddhi is not done, then therefore infertility can occur. Therefore, Bija Shuddhi is explained. Now, Pitta pacification drugs are also explained. I'm giving you the line of principle of the treatment in Ayurveda, not giving all the kalpas, because it is a huge list in that. Now, it helps in the process of nidation. This is very important. This part is very important because we have done many cases like that. There are cases where we have got IVF failures, where we have got IUI failures, recurrent abortion. They say that the endometrium is properly not receptive for that conception product. The fetus is embryo is created, embryo is then mitosis also occurs, the cell division starts. But whenever it is going to get implanted by breaking the Nitabux layer and gets implanted in the particular endometrium, this decidualization is not proper, and this endometrium, this embryo is not implanted properly. This is called as the disorders of the nidation. So if you do the Panchakarma procedures beforehand, or Uttar Basti, or some Falagruta like kalpas are given, then definitely these nidation issues are solved, and we can do simultaneously with the IVF procedures, or whenever the patients with IVF failures are there, definitely we can help the patient.
Hello.
There in puppet also. It is also helpful of the.
Hello.
Recommended kalpas are Falagruta, Shatavari Gruta, Kashwaryadi Gruta, and then Jivaniya Gruta also. Shatavari Kalpa is also excellent in this particular. Ashwagandha also plays a lot of important role. Use of I told in before some slides before that this particular kalkas and pichus are helpful in the acharana like Univapad or Aticharana Univapad, where actually you get some discharges, and during that discharge we can successfully treat with the kalka and pichu. In the case of structural deformities like Antarmukhi and Suchimukhi also, some kalkas and pichu are explained. But that was the case 5,000 years before. But nowadays we have excellent osteotomy or encephalage procedures which can be successfully done to treat this particular form of infertility. For proper facilitation of the intercourse, we have to have aphrodisiac Vajikaran drugs before a proper Shuddhikaran, which also I have explained before. Now, considering the dynamics of the Uttar Basti, this Uttar Basti is Uttara means Sreshta or excellent, or Uttar Margena Diyataya Basti. That is given by the other route. other than the normal Basti route. It is given by urinary route as well as vaginal route. Now here, this particular Uttar Basti, I have experienced that it can be given with the help of intracath, IUI cannula, or some feeding tube. Different modalities can be used, and 3 to 5 ml of Falagurta after the menstrual bleeding is stopped and before ovulation, that is means in the proper Rutukal it can be given. So Uttar Basti helps in the elimination of the tubal blocks as well as Falagurta. Uttar Basti helps in the proper nourishment of the endometrium, distillation, and the issues of the nidation, which I described before, failure of IVF or failure of the fertility, failure of the implantation. These particular issues are definitely treated. Now, there are some research articles about this fallopian tube blockage, effect of Kumari Taila Uttar Basti, role of Krishna Taila and Arka Pushpa Taila in the management of Artavakshaya, as well as Basti with the tribute and Lasun oil in the management of primary dysmenorrhea. So not only on the fallopian tube block, as well as in the development of the proper ovulation, in the development of the proper endometrium, as I said earlier, this particular Uttar Basti can be helpful. Now coming to the modern aspect of the infertility. Infertility, according to WHO, is a disease of reproductive system defined as the failure to achieve a clinical pregnancy after 12 months or more regular unprotected sexual intercourse. So you have to have the couple staying together. They should be performing intercourse, and there should be no any protection used as far as barrier methods or any other methods of the contraception should not be used. After that also, if that particular couple doesn't get a pregnancy, then this can be called as infertility. Types of the female infertility are primary and secondary. Primary means they never got pregnant, and secondary means they got pregnant once, irrespective of the outcome, but now unable to conceive. Means they got pregnant, there can be delivery, but it can be IUD, it can be a pregnancy loss, that is early pregnancy loss or abortion, but right now they don't have any child. I missed one of the slide in the Ayurveda part. Haris Samhita described different, Bhel and Haris Samhita described 6 types of fertility. Here there is one name called as Kakavandhya. So Kakavandhya is where they have one child, but after that they don't have any outcome. There are some different like Bala, Kakavandhya, Anapatya. These particular types have been described. Similarly, on this background only, modern medicine describes it on only 2 parts. That is primary, never got pregnant. Secondary, once got pregnant, but never again. So failure of never been able to conceive again. These are the different types or the different causes of infertility actually according to WHO. So whenever this particular algorithm or this particular chart graph changes, because when I was learning before 10 years, there were the unexplained infertility part was more, and where you have got infertility, male infertility in mixed cases, that particular part was less. Now we have explored about the unexplained infertility causes to a large extent, and now therefore this unexplained part has been reduced, and we can be properly considering or properly arriving to the part of the cause of the infertility. So as science changes and science develops, definitely we can have such modalities. Now, as far as the role of laparoscopy is concerned, we have got different papers where if you do a diagnosis, get the results in unexplained infertility, because properly there can be some different aspects or different etiological factors which can be identified with the help of this keyhole procedures, which are minimally invasive, which don't require much of anesthesia, and which don't require much of hospital stay also. Now, for endoscopy, is internal organs. We see inside is scopy, and there are different names given: histros is uterus, lapros is abdomen. These are some different fibroadenoma which we have taken out during laparoscopy, and on our left side we are seeing the image of different types of fibroadenoma. As we have seen in Ayurveda, Arbuda, Granthi, the same things are there which obstruct the implantation as well as nourishment of the endometrium, where this fibroadenoma is also a cause of the infertility. Now, myomectomies we perform as far as modern scientific method surgeries are concerned. HSG is one of the important diagnostic feature. On one side it is HSG, one side it is diagnostic laparoscopy. HSG is hysterosalpingography, where we push urographin dye inside the uterus to the cervix, and then we see whether the uterus is having some space occupying anomalies like fibroid or something like that, as well as if the dye comes out of the tubes, which is not there in this particular slide. So this is primarily corneal block. So these blocks are also seen. This HSG is very valuable and should be done in every case of infertility, where we can judge whether there is some space occupying lesion or tubal block, which is the cause of the fertility. In laparoscopy, we are able to see much more things than that, because it's a 3D view, it's an actual view, and likewise we are seeing on the right side, we can see the ovaries, we can see the fallopian tubes, we can see whether there is adhesions or not, whether the ovaries have some cyst developed, or the ovaries are atrophic, streak gonads, or there are some adhesions like endometriosis at the uterosacral level or external level. So whole view we can adjust, we can see the uterus size, we can adjust, we can see, and also the motility of the uterus, that is retroverted, anteverted. We see in antarmukhi univapor, that is uterus is retroverted. So similar, all these aspects of the uterus, infantile uterus, that our diagnosis. Now, polycystic ovaries are one of the important aspects, Steen-Lewalthal syndrome, that is been seen in all this era due to the change in the lifestyle, change in the food taking, that is junk food, and lack of the exercise, obesity, insulin resistance. And during this treatment of the polycystic ovaries, we have a lot of role of Ayurveda to play. Here, the basic mechanism is insulin resistance and hyperandrogenemia, where androgen starts developing because it's a two-cell, two-hormone theory. Cholesterol is the basic structure which develops into androgen under the activity of estrogen. This androgen gets converted into under the activity of the FSH hormone. The androgen converts into estrogen, while under the activity of LH, luteinizing hormone, it gets converted into progesterone. It's a normal mechanism on the menstrual cycle. But if this particular mechanism is disturbed by a concept called as insulin resistance, because for this conversion of the androgens into estrogen and progesterone, this insulin hormone is required. If the cells have less of insulin, or else cells become resistant to insulin, that is, they become refractory to insulin, then this particular conversion is hampered, and therefore the androgen is developed much in the body, and this androgen creates a lot of side effects on the body of the female, like unwanted hairs are developed, then the female particular figure is lost, there is dyslipidemia, there is obesity, as well as there is some acne is developed, and last but not the least, there is anovulation, means the ovaries do not produce properly ovum, and therefore this leads to infertility. This can be primary as well as secondary. So previously there was a concept called as wedge resection. The ovary is to be debulked, and therefore this particular lazy ovary, which is so called, it used to again triggered, and the functioning of the ovulation used to start, and that was the mechanism. But right now, due to the advent of the laparoscopy, we can have small drills in the ovary. This cyst can be drilled, and which leads to again a functioning ovary, and we can get good results. But modern medicine per se has got very limited role to play in this particular disorder. Yes, lifestyle can be changed. You can control the obesity, but apart from giving metformin or some spironolactone like drugs, modern medicine has very limited limited role to play. And moreover, these drugs are also having side effects which lead to hormonal imbalance and which hamper with the fertility. Therefore, Ayurveda It's Kiratatikta, bitter drugs like Kiratatikta and all. They have definitely a significant role to play. We have successfully conducted the trials of Uttar Basti in particular PCOS also, or Basti, where definitely we can get good results. Hyponid is one of the drugs which we are using, PCOS also, which contains this all particular bitter drugs, and definitely it helps in the reduction of the obesity in PCOS patient, as well as ovulation induction and properly fertility management also. This is Cochrane review of the PCOD, where if you do a ovarian diathermy, then definitely it is effective, because gonadotropin treatment, that is FSH, LH and other things, clomiphene, they are actually they give good results as far as PCOD is concerned for ovulation, but they don't treat PCOD, because the main causative factors of the PCOD, like lifestyle management or whatever Ayurveda thinks about that, are not properly treated. This particular chrome perturbation is about the tubal factors, which previously we have to be in books we have studied. That is, we do Rubin's test, which was actually many times in conclusive. We used to put air through the cervix, and with the stethoscope we used to check whether on one side or on both sides this particular air voice has come. Therefore, we wish to diagnose whether there is some tubal block or not. But there were a lot of limitation, because peristalsis voice also mimics with this particular voice, and there were some other artifacts also. So Rubin test was gone, HSG has come, there is no pain, there is less pain, there is no anesthesia required. After HSG, now we are perfing. Is the flow, it is coming forcefully or it is coming easily, or whether having some convolutions of the tubes which show adhesions, or there's some PID. Due to PID also these particular blocks are seen. Laparoscopic, we can perform adhesiolysis also, where adhesions are removed. But histoscopy, when performed, is one of the case conducted where was done and the patient got fatal. So these are some endoscopic methods which we can simultaneously diagnose as well as treat the case of the fertility. Now, according to modern medicine, there are some the common causes of the infertility are endometriosis, where there can be blocks, there can be adhesions, there can be reduction in the motility of the uterus, which leads to failure of the fertility. PID, pelvic infirmary disease, which leads to infection. Because of that, there is problems with the implantation as well as problems with the blocks. Then ovulation disorders are there, which we have discussed already in PCOS. Then elevated prolactin, which is a hormonal imbalance leading to anovulation, PCOS, then early menopause, benign uterine fibroids, and pelvic adhesions. Some fertility issues, there can be there is trauma to the tubes, previously treated for ectopic pregnancy, salpingectomy has been done, or tubal recanalization has been done. After that, then there can be anti-sperm antibodies which can be developed, autoimmune also. Ayurveda lifestyle has got a lot of role to play in this, because if the anti-sperm antibodies are developed, modern medicine per se doesn't have any role to play, because they only can suggest about the ovulation donation or surrogacy or IVF treatment. But Ayurveda definitely can have some, definitely leads to the problem. The outside membrane is so much hard that sperm cannot enter inside this particular side membrane, and therefore the infertility occurs. Therefore, intracytoplasmic sperm injection is done. But sometimes after ICSI also there is no pregnancy. So there that can be develop.
Hello. Hello. Ranade sir.
Am I audible? Connection is lost.
Yes sir, but slides should be shared again.
Yeah. Within a second.
Please proceed, sir.
Yeah. So
Yes.
whenever we are going to evaluate in the case of infertility, we have to have a history taking, proper history taking of the menstruation, proper history taking of the intercourse, as well as the diet and lifestyle things in the couple, as well as we have to have the hormones like FSH, LH, prolactin, T3, T4, DHEAS, progesterone, as well as AMH, anti-mullerian hormone. It is also important because AMH is correlative with the ovulation reserve of this particular female patient. If the AMH is low, then there can be less ovum in this particular ovary, and therefore we have to hurry about the fertility of this particular case, because day by day she can lose this chance of fertility. And if this AMH value is much more than the normal, then there can be one. Again, we can go for USG, HSG, BBT, that is basal body temperature. BBT is basal body temperature of the patient, of the lady patient, where it increases during progesterone surge, that is LH surge, during the 14th or 15th day, usually of a patient, during ovulation time. Therefore, this BBT method is also one important ovulation study. Before ovulation study, this particular BBT method was used. Now we can get some good LH kits also, where patient is not performing ovulation study, but ovulation study is the key test where actually we can ascertain that this ovulation has occurred. Then we can advise the patient for going for the intercourse, as well as we can perform the IUI of the patient, intrauterine insemination. Laparoscopy, PCT. PCT is the post-coital test where actually we perform it after intercourse. We take the spermatozoa from the posterior fornix as well as from the cervix. Here we can diagnose about the vaginal or cervical factor, where if it is not properly friendly to the semen or the pH of the semen, then definitely there can be spermatozoa loss, which can lead to fertility, which can lead to infertility. Immunological tests, as far as the fertilization problems are concerned, where recurrent IVFs are there, where there also we can utilize that. Coming to the end, we have got some hysteroscopy and laparoscopy videos actually, but they are not been properly connected. I would like to share about my thoughts as far as the integrated approach is concerned, because no pathy in the world is 100% effective as far as any disease is concerned. So we have to have a proper integration, proper holistic approach about the different pathies for towards the female infertility. Now, whatever my experience is there, we have to evaluate a patient properly as far as the modern scientific properly evaluated, as well as the diagnostic modalities which we perform, like laparoscopy, hysteroscopy of every patient diagnostic is very important, because in Ayurveda also the structural anomalies or abnormalities are explained, and definitely we can get a proper diagnosis of that. For such things where modern medicine doesn't have proper role to play, that is PCOS, as well as some ovum disorders or some streak gonads, where definitely we can primary ovarian failure, where low AMH, where definitely our kalpas as well as our different types of basti and panchakarma vishodhan treatment can be helpful. Whatever I'm trying to emphasize is that definitely we have a role to play, integrate role to play, as well as habitual abortions and IVF failures are concerned, because there are some nidation problem, implantation problem, where definitely if you perform uttar basti or some panchakarma procedures, definitely along with the treatment of the modern scientific medicine, we can definitely have a role to play of Ayurveda. So I have tried to summarize I would try to summarize the factors of female infertility, causes, definition, and different treatment modalities of both Ayurveda and modern scientific medicine. Ayurveda has a lot of things to explore, which we have not yet explored. But definitely, Ayurveda has explained all the causative factors, heterological factors, which are found day to day, and therefore we can definitely have some different useful methods, remedies, as well as Uttarabasti and other methods for treating fertility. Thank you very much for giving this opportunity for me. I once again thank the coordinators as well as Dr. Datta Patil, my friend, for giving me this opportunity. I am open to questions if the chairperson allows. Thank you.
Thank you so much, sir, for delivering such an informative and clinical approach regarding female infertility. So now it's time for discussion of queries. So there are some questions.
Yes.
Regarding your topic. So the first question is, how many Uttarabastis should be given in tubal block cases regarding female infertility?
Usually there is the research papers which I have seen. There is mention of the Uttarabasti, 3 Uttarabasti on the 6th, 7th, and 8th day whenever the menstrual blood bleeding stops, and there is recommendation for 3 months, which papers have gone across.
Okay, sir, thanks. The second question,
and my chairperson is more expert in this particular field. She can enlighten on this issue.
Okay, sir. So, second question is.
Sir, very good. This is the correct answer for the Uttarabasti.
Yes.
Sir,
next question,
the
please.
second question is, in case of infertility due to secondary amenorrhea, what is the line of treatment should be given?
Pardon me, can you repeat the question?
In secondary amenorrhea.
In secondary amenorrhea?
Yes, sir.
Your voice is not audible.
Amenorrhea. What is the line of treatment?
Okay, you mean to say what is line of treatment as far as Ayurveda is concerned, or modern medicine, or both?
Ayurveda, sir.
Hello.
Basically, Ranade sir, please. Madam, basically this is the infertility session, so we can't take this question at all. Okay, sir?
No, but we can answer secondary amenorrhea. Secondary amenorrhea is definitely because of the blocks, and we can have successful use of the Uttarabasti by Sahachar Tel in the case of secondary amenorrhea. And definitely anemia also can be the reason of secondary amenorrhea. So we have to treat the we have got Ayurvedic a lot of good kalpa, that is Tapadi Loho and Loharishta we can use in that, and we can with the help of the Uttarabasti of the Falagruta also we can nourish the endometrium, and definitely we can get good results. In Ayurveda, in Sushru Samhita, Falagruta is indicated or prescribed to be used by all roots for treating fertility. Nasya, oral root, Basti, Uttarabasti, for that purpose. Falagruta in its Falashruti has given excellent results as far as fertility is concerned.
Yes. That is the drug of choice of infertility.
Drug of choice of infertility. Next question, please, if it is
Next
there.
question. Is there any question?
Yes, last question. Which Ayurvedic medicines should be prescribed orally in case of PCOS?
Yes, actually we are not supposed to take the trade names, but which I like most is Hyponid by Charak, Charak for this Pharma. And second is my friend Dr. Shantanu Doshi in Pune, he has got a global pharma. He has developed one drug called as PCOS-NIL. This contains all they are not they are not this is rocket medicine, but it is they are the just and hyponid I use excellently in case of PCOS.
Okay, sir. Thank you so much. Now I request Dr. Jaimala Shirke ma'am to give concluding remark on the first session. Please, ma'am.
Yes, ma'am. Yes, ma'am. Thank you, sir. Thank you, Mandar. Thank you, Datta Patil, sir, Principal of Dhanvantari Ayurveda Medical College, Udgir, and all the organizers to chair this session. This is my gratitude to all my gurus in Prasuti Tantra Stri Rog, late Shubhda Velandkar madam, and Dr. Mrs. Meera Paranspe, Dr. Mrs. Mukam Umarji madam, and guide. Last but not least, my father and mother, and also my deep thanks to Datta Patil sir to give me chance for the chair to this session, and my blessings to Mandar. May I call you Mandar?
Yes, madam,
Mandar?
definitely.
Because you are my student, but not
Yes.
proper student, but now you are colleague, junior colleagues, you can say. And also the all the coordinators, Munde sir, Bhadre madam, and Chidre madam, sorry. Now about this session. Coming to this session, presentation of Mandar was very good. Nice presentation of Yonivapath and correlation of Yonivapath with modern techniques. Treatment explained was nice. Ayurveda approach and also modern techniques which are nowadays performed. Evaluation of cases he has done, and Uttar Basti. He said that Uttar Basti is the most important in the cases of infertility. In my opinion, also infertility means the Uttar Basti procedure. And about the causes, you know all, Rutu Kshetra Ambu Bij is the basic components of Garbhadharana, and also Mana, and Vidhivat intercourse is there. You have elaborated all the structures, all the features nicely, Mandar. In my opinion, Rasadhatu is the most important factor for performing the Raja or Rajovas Rotas. So when Rasadhatu is vitiated with the help of, you said that junk food and sedentary lifestyle, we can say, due to which rasa as well as Raja is vitiated, and the process of Bija Nirmiti is disturbed. And nowadays we can say that these positive factors are we see in all the patients. And the next, pH value is most important in vaginal pH secretions, which we can say that we can treat with what you say, Pichu Dharn, and along with modern techniques are also there. Tablets are given for pH secretions, pH value, to moderate the pH value. You know that. And Ushnatva Shitatva at the Prathamavarta, means vaginal area, is most important. Most Ushnatva we can have the spermicidal action, and most shitatva, we cannot have the sperms enter to the cervical canal. So we have to treat, we have to see, we have to per vaginal, we have to do per vaginal in that case. And at the last treatment part of view, proper history should be taken of sexual intercourse, and also the raja pravrutti, raja nivrutti, raja rutuka, all that. Ovulation time should be maintained. Ovulation time should be C, and endometrium. But with the help of ovulation ovulatory study, you can see the endometrium thickness, and if the thickness is low, we can do Uttar Basti as a Bruhan Chikitsa. So we can say the Panchakarma, with the help of modern techniques, we can success all the infertility patients. So last but not least, I am very much thankful to Dr. Datta Patil sir, Principal, Dhanvantari Ayurveda Medical College, Udgir, all the organizers of this session, Dr. Munde sir, Dr. Bhadre madam, Dr. Chidre madam, and all the other departmental technicians, or all them, and not for, I'm saying that, who are the guest, Dr. Dumre sir, who is from Ashtanga Ayurveda, and myself is also from Ashtanga Ayurveda, and also Mandar is also from Ashtanga Ayurveda. So 3 Ashtanga Ayurveda participants are there. So lastly, I am very much thankful to all the organizers. Namaskar.
With the permission of the chair, I want to add one thing.
Yes, sir.
With the permission,
Yes.
at 4:30 p.m., I am live on SAM TV, and we have taken a very difficult subject, Corona-19, COVID-19 and antenatal care. So please, I am requesting all of you to watch this particular program. Thank you very much.
Okay. Okay. Over to Bhadre madam for next session. Bhadre
Thank
madam.
you so much, ma'am, for giving elaboration regarding female infertility. So we are lucky to have you and Dr. Mandar sir for today's webinar. Now, I would like to hand over our second session of the webinar to Dr. Deepika Bhadre ma'am.
Good afternoon all. First of all, I would like to welcome all of you in the second session of the webinar. We have Dr. Rujuta Dubey madam as the chairperson of the second session, and Dr. Ganapate madam as a speaker of the second session. Dr. Rujuta Dubey madam is professor and HOD of Prasuti Tantra Evam Stri Roga Department at SNKD Ayurveda College, Nalasopara. She is member of Board of Studies and Board of Education in Maharashtra University of Health Science, Nashik. She completed UG from KG Mittal Ayurvedic College, Mumbai, and PG from Poddar Ayurveda Medical College, Mumbai. Madam has teaching experience of 30 years. She has published many articles in various publications like a conceptual study of Mudagarbha, a literal review of Artha Vapat with special reference to PCOS, a ray of hope in diabetic mellitus, etc. She is one of the senior and leading gynecologists in Nalasopara. She conducted more than 1,500 deliveries. Now, I would like to introduce our second session speaker, Dr. Gauri Ganapate madam, who is Associate Professor in Prasuti Tantra and Stri Roga Department at Sant Gajanan Maharaj Ayurveda Medical College, Gadinglas, Maharashtra. She completed UG from Bhai Saheb Sawant Ayurved College, Sawantwadi, and completed PG from JG Ayurvedic Medical College, Ghataprabha, Karnataka. Also completed PG Diploma in Nutrition and Dietetics. She delivers lectures related to gynecological complaints and diet for all. She also writes articles in newspapers. She has her own YouTube channel named Sobat Sakhichi about diet and health of the females. Now, I request Dr. Gauri Ganapate Madam to deliver a lecture on Garbhasanskar, a way to blissful progeny.
Thank you. Am I audible?
Yes, ma'am, you are audible.
Okay. Shall we start?
Yes, ma'am, you will start.
Okay. Good afternoon, all. Myself, Dr. Gauri Ganapate. I welcome you all in today's session. First of all, I thank and congratulate Mr. Mandar Ranade because he has delivered an excellent talk about an integrative approach towards infertility. As we know, definitely integration is the need of time. When infertility ends in good news, it is the most exciting moment in the life of that couple. Not only infertility conception, but couples having natural conception also, they are very much eager and anxious about the outcome of the pregnancy. Next slide, please. Nowadays, every couple wants super baby in this super competitive era. They want brilliant, multi-talented, aggressive, impressive, social, emotional, good grasping, all these in many more qualities in a single child. Of course, it is natural instinct that we should have the best, but with the help of proper Garbhasanskar, it is possible also to have so many qualities in a single child also. Next. Mother is always connected with her child for lifelong period. But during her antenatal period, there is very much close contact of the baby and the mother. There are some references in the ancient texts, and it is proved through the many scientific studies also that whatever mother thinks, how she behaves, and what she eats, all affect her baby in the womb. Next. You must have heard the story from Mahabharata, how Abhimanyu was aware of entering the Chakravyuha during the war with Kaurava. He had learned the tact by listening the discussion of Lord Krishna and her mother, his mother Draupadi, when he was in his mother's womb. How he learned about it was Garbhasanskara. It was the sad part of the story that Abhimanyu could only knew how to enter in it because his mother fell asleep while Sri Krishna was telling about how to come safely throughout it. What is meant by Garbhasanskara? We shall start now. Garbhasanskara means putting good things in unborn child. It is also called as prenatal and antenatal communication in modern era. According to law of cause and effect, whatever you send into the universe comes back to you. In the same way, during pregnancy, mother's womb is universe for the growing fetus. So whatever she puts in the womb in form of good or bad things comes back to her in form of qualities of her baby. Next. As we discussed earlier, Ayurveda is a life science. And what's special about Ayurveda is the Charya Sankalpana. That is Dinacharya, Rutucharya, Garbhini Paricharya, Sutika Paricharya, and many more. It has thrown the light in almost every smallest phase of life and guided according to it. Being a student and practitioner from Ayurveda faculty, we all know importance of Garbhasanskara, which is for Supraja Nirmiti. Garbhasanskar helps us for healthy progeny with good physical and mental qualities. We have learned the topics listed here like Garbha Sambhav Samagri, definition of Garbha, Matruja Pitruja Dishadbhav, मासानुमासी गर्भवृद्धि, month-wise treatment for history of abortions, Garbhini Paricharya, and the list goes on. Next. As we previously discussed, importance of Garbhasambhav Samagri. Before 1000 years ago, Ayurveda has mentioned factors necessary for Garbhadharana as Garbhasambhav Samagri. In today's era also, they are compatible and comparable with the factors with modern science of fertilization. Like Rutu Kala, we can correlate with ovulation. Kshetra, locally, we can correlate it with Garbhashay, and globally, as whole female reproductive system. Ambu, with maternal nutrition or mother's ahara rasa. And of course, Bija, good quality of ovum and the sperm. Next. This shloka explains definition of Garbha as Shukra Shonitam Garbhashayastam Atma Prakriti Vikara Samurchitam Garbha iti uchyate. Means definition of Garbha as union of Shukra and Shonita in the region of Garbhashaya with presence of Atma, Prakriti and its Vikara. Shukra, Shonita, Vata, Pitta, Kafadi dosha are all important for Sharira Prakriti of Garbha, and Atma, Sattva, Raja, Samadhi factors determine the Manasa Prakriti. Next. These two shloka, Garbhastu Khalu, Antariksha Vaivagni Bhumi Toya, Vikara Chetana Adhisthana Bhutaha, and other one is these two shloka, here the presence of Chetana Dhatu and its importance in viability of the fetus is underlined. During embryological development, pregnancy is not live unless and until we see cardiac activity on sonography. In absence of cardiac activity, we label them as blighted ovum or missed abortion according to the presentation. Can we correlate Chetana Dhatu with activity force necessary for fetal growth? We should think over it. Next. Then we have do's and don'ts in form of Garbhini Paricharya and Garbhopaghatakra Bhava. In broad spectrum, we can say what to do is explained in Garbhini Paricharya and what not to do is explained in Garbhopaghatakra Bhava. Pregnancy is a period of 9 months, and this stage should be handled very carefully. Even a small mistake can lead to adverse outcome of pregnancy like abortion or preterm delivery or any other complication which can lead to adverse outcome of pregnancy. Next, in today's era, many women are working outside their home and they are traveling every day till the delivery of the baby. If we are conducting Garbhasanskar courses for them, we have to give practical guidelines which are useful in their day-to-day activity, like not to use very high heels, instead use flat chappals, use footrest while sitting for hours together in office chairs. We should advise them to use seat belt while traveling from her car to her workplace. Also, we should advise her to take proper antenatal care. Now, what antenatal care means? Next. Antenatal care, like Garbhasanskar and antenatal care, these both can be clubbed together. Garbhasanskar actually is a combo pack of Garbhini Ahara, Garbhini Vihara, and psychological fitness. Means diet, yoga, psychological fitness to prepare expectant mother for pregnancy and childbirth. As an Ayurvedic physician, we can do this job very effectively. Ideally, every pregnancy should be planned. It should not be accidental, or it should not be happened by chance. Physical, mental, and nowadays financial also. So these three planning, physical, mental, and financial planning is necessary before taking chance of pregnancy. Next. Actually, care of expectant mother starts, or actual process of Garbhasanskara should start from pre-conceptual period. As health of future mother and father, their relation or bonding with each other affect the psychology of the mother and of course psychology of the fetus also. So try to concentrate and improve these relations. Physically, avoid all types of bad habits, especially tobacco, alcohol, cigarette smoking, at least 3 months before the conception. Mother should be advised to correct her BMI, body mass index, in normal range between 18.5 to 24.9. If she is obese or have any medical family history, she should be investigated accordingly. There may be long list of investigations, but routinely CBC, blood group, HIV, urine routine, blood sugar, if necessary thyroid levels may be helpful as basic investigations. Preconceptional panchakarma, as we discussed earlier, like Vamana, Virechana, Basti, and specifically Uttar Basti with Falagruta, Durvadi Gruta, or any Gruta prepared with Garbhasthapana Dravya positively affects pregnancy outcome. Next. Growing baby basically depends upon mother solely for its nutrition. Diet plays an important role in the physical nutrition of the baby, and to certain extent, it affects mental development of the baby also. No one eats perfectly every single day, which is the reason for why proper diet in pregnancy is advised and it carries more importance. If we correlate Masanomasic Garbhavruddhi, embryological and fetal developmental phases, nutritional needs according to every month or at least every trimester, we can advise a diet with very good manner. Diet is not ready-made chart to be given to all pregnant ladies. It is tailor-made because we have to consider many factors individually like Prakriti, Agni, Koshtha, Jarana Shakti, Abhyavarana Shakti, then previous state of nutrition, any risk factor, and many more. But for sure, pregnancy demands additional nutrition because of growing and demanding diet partner named fetus. Madhura Rasa, as we said earlier, it is a Bruhaniya, Santarpaniya. So naturally, diet should be more in Madhura Rasa, but Madhura means not necessarily, it means only sugar, jaggery, and honey. It should be proper combination of simple carbohydrates as well as complex carbohydrates. And of course, all other 5 rasas are also required for proper nourishment of the baby. Next, foods to eat during first trimester of pregnancy. Pregnancy nausea, food aversions, fatigue in Sadyogruhita Garbha Lakshana can make eating for two, means for mother as well as her fetus. It make a challenge in first trimester of pregnancy. We know hormone progesterone in particular triggers the digestive discomforts including reflux and constipation both at a time. Small and frequent meals keep hydrated to avoid dehydration and extreme weight loss in this type of patients, means in first trimester. Advise citrus fruits to fight against nausea, vomiting, hyperacidity if tolerated. If the patient is having trouble with the portion size of the food, concentrate on the quality of the food. Means small quantity but having good amount of nutrients. Try to advise dry fruits like black raisins, dried figs in small and frequent amounts to get good amount of energy, source of protein, and to overcome constipation. Dried toast can also be used to prevent regurgitations. More focus should be given on folic acid and DHA. Also omega-3, which is the most essential micronutrient in the first trimester of pregnancy. Folic acid, which is also called as B9 when it is in food form. So dietary intake of at least 600 microgram per day of folic acid is required to avoid the neural tube defects. Likewise, we can use some food items some Aharya Sankalpana logically to control the first trimester complaints. Sometimes whenever patient comes to us, we advise ondansetron. Ondansetron is a anti-emetic drug, only anti-emetic drug, and it also causes constipation. So if we use Sudhshekar, Kamadudha, or Prava Panchamrut, they have soothing effect on our gut and they help to relieve the symptoms of first trimester of pregnancy. Next. Second trimester of pregnancy. Dauruda is the main entity found in second trimester of pregnancy. Dauruda is a craving for particular type of food prominent in fourth month of pregnancy. If we consider Panchami Manaha, Shashthe Buddhi, accordingly we can suggest Medhya Dravya, Govruta to sharpen the memory through the diet and medicines. It will really help. Inclusion of akhrots and badams in second trimester diet, especially in 5th and 6th month of pregnancy, really helps. Diet from 5 food groups fulfilling RDA, means recommended dietary allowances of all macronutrients, means proteins, fats and carbohydrates, and micronutrients, means vitamins and minerals, is more important. Of course, government is providing free iron and calcium tablets to all pregnant ladies. It is advisable to get increased dietary sources of iron and calcium. Dietary sources, not medicinal. Dried dates, beetroot leaves, moringa leaves, milk, ragi, jaggery. These are all have iron-rich and calcium-rich contents, so they can be used safely and effectively during the second trimester of pregnancy. Dried fruits, nuts, oil seeds are the major source of energy as well as proteins. Diet rich in calcium, especially in the month when bone formation takes place, may help to build the strong bones. It is the myth that pregnant ladies should not eat papaya, mangoes, but it is not the fact. If taken in small amount, high intake of vitamin A can cause abortions in some cases, and the mentioned fruits, means papaya and mangoes like that, they have fair amount of vitamin A. So it may be advised not to take in smaller quantity also. But according to modern dietetics, they are very much safe if we take it in moderate amount or in small amount. Next. What guidelines should be obeyed in the third trimester diet? Along with other nutrients, more intake of vitamin C, thiamine, fibers, and water helps to fulfill the nutritional needs in the third trimester of pregnancy. Extra fat accumulation and extra calories are needed to store the stock of energy during lactational period. If these extra calories are gained through high protein diet instead of high fat diet, just remember, high protein diet instead of high fat diet, it will be more easier to come to pre-pregnancy weight, body weight. In ideal condition, pregnancy demands 300 calories more than your non-pregnancy daily need of calories. It demands 15 grams of more protein than non-pregnant stage. Calcium requirement is increased from 400 milligrams to daily to 1000 milligram daily. Iron requirement is also increased from 30 milligram to 38 milligram. Requirement of B complex is also increased. It is roughly estimated that during first trimester, calorie requirement will be met by increasing 10 calories per day. It seems to be funny, but during second trimester, 90 calories per day if it is increased, and in last trimester, 200 calories per day in last, means it's in third trimester. It is required, and if we are taking the amount of food like that, calorie wise and also nutritive wise, it is definitely helpful for the baby and the mother also. Next. After diet, Ayurvedic Garbhasanskar is not complete without Yogasana. And we have the topic of Yogasana in our Vastavruta subject for a year. So we are the basic, so we should know the basic about the yoga and general guideline or general logic, what exercises should be advised in first trimester, in second trimester and third trimester, we can easily correlate. After a short talk of pregnancy diet, let us move to important point of exercises in the pregnancy. What is the importance of exercise during pregnancy? It basically increases the flexibility of body. It tones up the pelvic floor muscles and it controls over the breath and as well as also on the mind. Up to the end of third month, uterus is pelvic organ. So pregnant lady can do any type of yogasana lying on abdomen safely. Next. There is not any particular format or sequence of exercises, but yes, stretching for some minutes, breathing exercises for some minutes, different type of yoga postures in standing, sitting, and supine positions are very helpful. Of course, post-exercise relaxation different type of pranayama. They help to get good control over mind and breathe too. Sectional type of breathing means abdominal, thoracic, that type of breathing, Omkar chanting, Trataka, meditation, all these are helpful during second trimester of pregnancy. Next. During second trimester, uterus becomes abdominal organ and there are some restrictions after first trimester. But we should logically advise the patients accordingly. Of course, cardio type of exercises like jumping jacks, it is better to advise. Also, better to avoid HIIT, means high intensity intermittent training exercises, high level of aerobics. But it is always preferably to do some light type of exercises. Yogasanas are always advisable as they carry low risk of abortion and preterm delivery. But expert and individual attention is needed. Swimming is very good exercise during second trimester of pregnancy. Next. You must have seen viral photographs of Anushka Sharma doing Shirshasana, Kareena doing yoga in sitting position. So actually, it is a good message to society to be as normal and as active during pregnancy period and help them to become fit and fine soon after delivery and without losing their forms. You know, both are Anushka Sharma and Kareena are back to work within 2 months of delivery. Whether it is correct according to Ayurveda or not, that is another question. But prenatal or antenatal exercises help the patient to become fit and fine soon after the delivery. Next. Third trimester yoga, third trimester exercises for pregnant women. Third trimester is especially last 2 months. They should carry exercises of perineal and thigh muscle exercises, but strictly under supervision because of increased weight of fetus and abdominal size. Balance of body should be taken care of. Butterfly type of exercises help a lot in relaxation and strengthening thigh muscles and perineal muscles too. Next. Practice of Puraka, Kumbhaka and Rechaka. These 3 techniques in form of pranayam, different types of pranayam, help in bearing down during second stage of labor. How to take the breath in, how to hold the breath and how to bear down. These all techniques she can learn in third trimester practicing Puraka, Rechaka and Kumbhaka. Pranayam, mindfulness exercises, they all help the pregnant lady to be mentally fit during the whole process of childbirth. Next. Pregnant lady should continue all second trimester exercises in third trimester also. If pregnancy is normal, means without any risk factors, then squatting exercises, of course, under guidance of trained yoga teacher, are also very helpful. Leg exercises in sitting position help to avoid DVT, varicose veins, and muscle sprains during last trimester of pregnancy. Yoni Pichu, Anuvasan Basti in last month of pregnancy is advisable in Garbhini Paricharya, and it should be the part of routine life in last month of pregnancy. It gives good results and make you special because you by yourself offer a chance for normal delivery to your patients, which is very rare nowadays. Nowadays, every patient, it is said that every patient is suddenly picked up for the vaginal cesarean section delivery. If you are aware of any of term in the list of exercises like Omkar medication, silence, or what is mean by Nada type of exercises are mentioned in the list. You can Google and have a nice photographs and information about this type of postures. Next. What are the impacts of Garbhasanskara? Huge number of scientific studies are going on in different countries and the results are promising. They are studying it at molecular level, cellular level, emotional, psychological level, and more other. Special thing to be mentioned is that these research studies are going on with their modern research protocol, so the whole world, other than Indian people, can know it in the global research language. So we will see or we will highlight the conclusions according to modern research methods and the studies doing abroad, outside the India at various level, as we said, molecular, biological, psychological, emotional level. Next. Maternal attitude. One research was done in which studied the maternal attitude towards pregnancy, and the conclusion was maternal attitude towards pregnancy has positive or negative outcome or positive or negative impact on the child. At many places, we find hatred behavior of the kids towards the parent. Can we correlate with the outcome of unwanted pregnancy? Maybe we can. If pregnant lady has insecure feeling throughout the pregnancy, her child is also found to be emotionally weak and unbalanced. Hence, pregnant lady should be encouraged to think positively and be happy. Next. We should also think about fetal psychology, and the study has going on. If the pregnancy is unwanted or against the wish of the mother, then her psychology throughout the pregnancy is negative, and she might be in stress. She might secrete more of bad hormones, cortisol, which can affect cortisol level of fetus, and it can affect fetal psychology. But if mother is mentally prepared for the pregnancy, if the pregnancy is pre-planned, then she can enjoy it and secrete more of good hormones of pregnancy, serotonin, dopamine, oxytocin, endorphins, are famous happy hormones that promote positive feeling like pleasure, happiness, and even love also. Next. We should know about genetics and epigenetics. More research is going on. Till date, we were taught that genetic composition comes from mother and father and they are carried as they receive. Means they have just copy-paste option. But now, new research is going on and it says genetic coding has edit option also. And the science is called as epigenetics. It is working on epigenome, which states that we can change bad effect of deceased gene with the help of balanced diet, healthy lifestyle, and mindfulness meditation. The best time to do this is when genetic window opens, and it is the maximum period during antenatal period. So if the expectant lady is taught how to think, how to train the brain, she can definitely contribute to better generation of new epigenomes. Next, birth defects are usually harassing, but if a couple they have history of previous birth defects, through proper diet, yoga, Garbhasanskar, it will be definitely useful for them to have better outcome for future generation, having low risk of genetic factors or genetic disorders. Next, bonding. Bonding between mother and the baby. It has been illustrated that if the bonding between mother and child is strong enough through the dialogue with fetus, if the mother has the quality or the mother had habit or she practices how to have a dialogue with the baby during antenatal period, and she spends quality time in early childhood with the baby, it positively affects the personality of the child. The child becomes more social, expressive, and it can share its emotion verbally. Next, some researchers have it has been proved through scientific experiments that if mother practices mathematical calculations, engage herself in solving jigsaw puzzles, her child is born with good IQ and with good judgmental skill also. Next, we are just touching the conclusions, or we are touching the experiments going on and the conclusions through them, and the effect of these mindfulness. Not all mindfulness means merely meditation. Mindfulness is noticing the moods and bodily sensation as they are, and then to direct them in a right way. 4 types of positive health effects on the baby are: mindfulness reduces stress both in mother as well as baby. It boosts positive feelings in mother as well as baby. Unless proved otherwise, it helps in prevent premature birth. Not anatomical causes, accidental causes, all these we have to exclude. But psychological trauma or other than that, shock, bhaya, all these factors which can be lead into premature birth, with help of mindfulness we can prevent them. Mindfulness promotes healthy development of the baby. Next, neuroscience. It has been proved there is maternal, placental, fetal neuroendocrine system or neuroendocrine axis, especially by placental corticotropic releasing hormone. Maternal environment exerts a significant influence on fetal autonomous nervous system as well as central nervous system. Processes related with recognition, memory, and habituation are increased with help of neuroscience and training the neuroscience through mindfulness programs. Next, DOHAD. This is very useful and very important phenomena. DOHAD means developmental origins of health and diseases. It has been postulated that exposure to certain environmental influences during critical period of development and growth may have significant consequences on the individual short-term health as well as long-term health. The concept was like that: developing fetus, if exposed to hostile uterine environment, such as insulted by poor nutrition, infections, chemical exposures, metabolite or hormonal insults, fetus respond by developing adaptations. They adapt themselves to the poor situations, and it not only foster its immediate viability but also in its survival if the similar environment is encountered in the latter stage of life. Means jahan bhi dalo, they adjust with themselves to the surrounding environment. So this is a nice phenomena, and they have scientific base also. Next. Yeah, this is also a research paper I found on the net. Apart from having early recovery of mother in normal delivery, means the point is benefit of normal delivery for mother as well as baby. Mother had full positive effect of normal delivery as she returns to her work easily and within some days only. Baby also has some benefits, like baby who come out through the birth canal are at an advantage of ingesting beneficial bacteria through the gut. Less breathing problems in the baby while normal delivery. Fewer from surgeries. They can get early breastfeeding and not having any discomfort. She can breastfeed the baby within half hour after delivery. One interesting study was done abroad where they allow husband to be present in the labor room. They found that the husbands who had their own delivery by normal vaginal route, they were strong enough while attending their wife's delivery. But the husbands who had their own difficult delivery, they could not stand strong enough and had the strong headaches, fainting attacks, and other similar problems. When they were hypnotized and they were mentally carried back to their early life, some of them revealed that they had problems in antenatal period. Some had history of high risk pregnancy. So, isn't it interesting? I found very interesting background or interesting topic. Of course, some of you may not believe, but these are some experiments. They are carried out in the world wide and known scientific and maternal centers over there. Next. Yes. Coming to the ending session of this topic, music and pregnancy. It is the integral part of Garbhasanskar. It is proven that music plays important role in the brain development of the fetus before birth. Listening to music during pregnancy will not only have soothing effect, but it has uplifting effect on the pregnant woman, but also positive effect on the unborn baby also. It is found that around the 16 to 18 week of pregnancy, little one bears ears and they hear the very first sound. By the end of 24 weeks, the little ears start to develop rapidly and the babies have to be shown to turn their heads in response to voices and noises in last few months of pregnancy. The unborn baby can recognize her mother's voice, native language, and word patterns and rhythm in antenatal period only. Next. So what type of music should the pregnant woman listen to? In the third trimester, baby will definitely able to hear the music which is played by the pregnant lady. So classical music, gentle sounds like lullabies, nice melodies that inspire the happiness, all designed to be soothing. In Indian ragas, Rag Malkamsa, Shantarag, Bageshri, Rag Yamana, Bhairav, Kalyani Rag, Gayatri Mantra, Omkar chanting, all these are helpful. Music at early stage help the children to express themselves and they start sharing their feelings. Music releases endorphins of the baby also. It reduces maternal stress, anxiety, and depression also. Next. So, Garbhasanskar is such a big and deep topic that we can have a full day lecture on each and every small topic discussed in today's session. Still, I have tried my best to touch the maximum point in 50 minutes time. So I thank Dr. Datta Patil, sir, and Shri Dhanvantari Ayurved College, Udgir, and other organizers for giving me this opportunity to communicate with you all. Advancedly, I thank to my chairperson, Dr. Rutuja Dubey, Thank God for good connectivity and a big thanks to all of you. Thanks a lot.
Thank you, madam, for such a nice explanation of Garbhasanskar. Now I request Dr. Sorry, ma'am. Now it's a time for questions. There are two questions. First question is, which type of Garbhini Paricharya should be followed in case of oligohydramnios?
In case of oligohydramnios.
Yes, ma'am.
Garbhini Paricharya, as we all suggest routinely for all Garbhini, is the same. Of course, oligohydramnios is a special case, and in that we can consider Rasa Dhatu Kshaya. So for increase the Rasa Dhatu, we can use plenty of oral liquids and Rasa Dhatu Vardhana, Madhura Rasatmak Dravya, Jivaniya Bruhaniya Dravya, and to use many of liquid diet to increase the proper proportion of water in the body, and also simple measures taken in the Garbhini Paricharya will help to keep the balance of liquor in the uterus also.
Second question, ma'am. What is the role of music therapy in Garbhasanskar?
Hello?
Yes, ma'am. What is the role of music therapy in Garbhasanskar?
Okay, already we have highlighted music in Garbhini. It releases the endorphin, means create the happy mood in the pregnant lady, as well as it creates the happy mood in the transfers the happy mood to the baby also. Baby also have soothing effect and happiness in the uterine environment. It reduces maternal stress and anxiety in mother and depression during the antenatal period, whether the delivery will be normal, what will be the outcome of the pregnancy, like that. All questions are there in the mind of the pregnant lady. So she can have relaxing mentality with help of music. In case of PIH, pregnancy-induced hypertension, in that case, music also helps a lot. And in riskful deliveries or in any risk type of risky pregnancy, music will mental abilities or the mental central nervous system cooling down in that. Hello?
Yes, ma'am. One more question is there. Are there any specific asanas to promote normal delivery?
We have already told in the first trimester, second trimester, and third trimester. Last trimester, we have already elaborated the name of asana, like butterfly exercises, squatting type of exercises, and pranayama. Also with the help of pranayama, Purak, Rechaka, and Kumbhaka.
Okay, ma'am. Thank you for such a nice information.
Okay, thank you.
I would like to request Dr. Rujita Dubey, madam, to give a concluding remark on this session.
Am I audible?
Yes, ma'am.
Yes, madam.
Yeah, first of all, good evening to all. And my sincere thanks to Dr. Datta Patil, Principal of Udgir College, and the Stri Rog Prasuti Department, all the faculty members. Very nice lecture given by Dr. Gauri Ganpate madam. The topic was Garbhasanskar in blissful pregnancy. And really she has elaborated the topic very nicely, because pregnancy is the period, it is the precious period for the both mother and fetus. And mother is said to be Dauruda at this time. In Ayurveda, it is called Dauruda. So it is the most sensitive time for the both Garbhini and Garbha. And Ayurveda has described Masanumasik Vriddhi at this period. And in every month, Garbha is developing, and its man and buddhi develops at 5th and 6th month. So Garbha is really sensitive and receptible at this time. So Garbha Sanskar is given by seeing good, eating good, hearing good, and that gives good mental development and physical development to the fetus. Whatever mother eats and thinks and behaves gives impact on Garbha. So it is very much necessary to take care in all antenatal period and postnatal period too. So in this period, whatever the Garbha receives, it gives impact on its brain and total nourishment. So it is very much necessary to give Garbha Sanskar to the Garbha. And obviously it is given through the mother, because there is no other source to give such a things to Garbha. Dr. Gauri Ganpati madam has described everything in her lecture. Total ANC period, what should be taken, what should be eaten, what care should be taken for the pregnant woman, what are the beneficiary things, and how we can get a good outcome of the pregnancy and a good baby, which gives a really happiness to their parents. And of course, as she described, that everyone wants the all qualities in our child, in their child. So to take and give Garbha Sanskara to the Garbhini. So I congratulate Dr. Gauri Ganpati madam for giving such a beautiful lecture. And I also congratulate Dr. Mandar Ranade for elaborating such a nice topic, Vandhyatva or infertility. So with this few words, I conclude the lecture that it was a very nice session. And again, I thank all the respective dignitaries, that Dr. Jaimala Shirke madam, Dr. Satish Dumbre sir, Mandar Ranade, and the faculty of Sri Rog Prasuti Department, Munde sir, Chidre madam, Bhadre madam, and our respected Dr. Datta Patil sir, principal of the Udgir College. And I'm very much thankful to all of you for giving me such a nice opportunity to be as a chairperson. Thank you very much.
Thank you.
Thank you, ma'am. Once again, I am thankful to the Dr. Ganpati madam
Okay,
and
thank
Dr.
you.
Rujuta Dubey madam. Now, there is an inaugural speech which has been postponed due to other schedules and some network problems. We have Dr. Satishji Dumbre sir as a chief guest, who is ex-faculty in Ayurveda and faculty member of MUHS Nashik. He is principal at Ashtang Ayurveda Mahavidyalaya Pune, also a very good physician with skillful personality. Now, I would like to request Dr. Satishji Dumbre sir for the inaugural speech.
Good evening, all. I am audible.
Yes, sir.
Yes, sir.
Actually, the deliberation was at the onset of the webinar, but due to some technical difficulties, I came in a late time. Sorry for that. At the onset, I thank Dr. Datta Patil, the principal of the Dharmantari Ayurvedic Medical College, and Dr. Munde for giving me the opportunity to share my thoughts with all the participants. I know I am not from the Prasuti Tantra Sri stream, but as a student of Ayurveda, I have some thoughts about the Garbha Sanskara. And after discussion with Dr. Datta Patil, I dare to talk some views in front of you within few minutes only. Friends, day by day, the practices of microfamily is established around all over the world, and single child family is becoming an social need. In such type of present era, everybody is thinking and evolving to fulfill the single child with all the qualities required to stand successful on the earth. I think in this angle, we have to think and consider our powerful tool, Garbhasanskar. In the Garbhavastha, whatever Garbha listened and experienced, he or she has ability to grasp and store in the mind. According to month-wise development, Masik Garbha Pariddhi, from 4th month, Garbhini become Dvaurudhini. She has to bear with both the hearts, herself as well as Garbha's Hruday and its activity. From 5th month, Garbha's mental activities are started, and in the 6th month, Buddhi activates in Garbha's mind. Especially the windows of Dhi and Smruti are opened and activated. I think in this time slot, our Garbha Samskara will play very crucial role. Everybody knows the example of Veer Abhimanyu. Dr. Ganpati Madam already given this. When Abhimanyu was in Garbhavastha, he listened the knowledge of Chakravyuha from Mata Draupadi. But because of busy work schedule of Mata Draupadi, Abhimanyu get only half knowledge, how to enter in Chakravyuha. And in the future, everybody know what is happened of Mahabharata. Abhimanyu distracted the Chakravyuha and enter inside. But because of half knowledge, he couldn't come back and died. If Mata Draupadi gives full knowledge of Chakravyuha to Abhimanyu, history and maybe the result of Mahabharata would have been different. So I think the need of Garbha Samskar is the need of today's era. Only we have to use this magical tool in very effective manner to build the attitude and aptitude of new generation strong and intellectual. I think only these views I want to share with everybody. Garbha Samskara is a very different tool, not described in modern medicine, but this is the global need. I request all the authors of Prasuti Tantra Stri Rog to please use in today's era this very magical and effective tool as a part of Ayurveda. Thank you, Dr. Patil, Dr. Munde, and other organizers to give me the opportunity to share my views. Thank you all. Thank you.
Thank you, sir, for joining us in today's webinar. Now, I would like to request our beloved principal, sir, Dr. Dattatreya Patil, sir, for the presidential address.
Honorable Vaidya Satiji Dumre, ex-faculty dean, MUHS Nashik, my dear friend, who had delivered a very beautiful lecture, Padyamanna Ranade, Honorable Trustee of NK Dubey Ayurveda College and Head of Department, Honorable Dubey Madam, another eminent speaker, Honorable Gauri Ganpati Madam, and respected Principal of
Ayurveda College, Gondia, Honorable Chirke Madam. Definitely, the way this national webinar on female infertility and Garbhasanskar had been conducted by our Dhanvantari Ayurveda Medical College. First of all, I am very much thankful and grateful to all the eminent speakers, chairpersons, and the guests, and not at the least the participants who have participated in this webinar. Mandar himself is a good orator, a best gynecologist from Ayurveda faculty, and also a very technical and legal expert who is rendering his services at Pune in this particular field of female infertility. As far as Gauri Ganpati ma'am is concerned, she too is working at Ratnagiri. And I know I had been there with both the Dr. Gurunath Ganpati and Dr. Gauri Ganpati. They are working in this particular field of Garbhasanskara, which is need of hour, because just as you say, everybody is in a great time of this Garbhasanskara. Initially, this was clearly mentioned in our Ayurveda science, and now Yatha Pinde Tatha Brahmande. If this thing is to be considered, that Pind and Brahmand, rather progeny, it should be good one. So I congratulate our faculty members of our institute for organizing this particular seminar on the particular topics. I hope all the delegates or the participants have been enriched in these two subjects. Once again, on behalf of our institution, our president, Honorable Balasahebji Jadhav, ex-minister, and Honorable Babasahebji Patil, MLA, this is our 7th webinar. We have series of webinars. I am feeling proud that as far as though this webinar is on YouTube live, but each and every webinar which we have conducted in the past had crossed 1,000 participants. Definitely in the days to come, all these participants, we have thought for practitioners also, for the UG students also, and for the PG students also. In all these three sectors we have worked. So thank you once again to one and all, those who have participated, those who have delivered speech, and those who have cooperated for this particular webinar on role of Ayurveda, rather in two things, female infertility and Garbhasanskar. Thank you one and all.
Thank you, sir, for the presidential address. Now it's time for the vote of thanks. I would like to thank our inaugural guest, Honorable Dr. Satish Ji Dumre, sir, for inauguration of our national webinar. I would like to thank our chairpersons, Honorable Dr. Jaimala Shirke ma'am and Honorable Dr. Rujuta Dubey ma'am, for joining us with their knowledge. I would like to thank our guest speakers, Honorable Dr. Mandar Ranade sir and Honorable Dr. Gauri Ganapate ma'am, for giving their valuable insights and delivering such an informative lecture. I would also like to thank our beloved principal sir, Honorable Dr. Dattatreya Patil sir, for giving permission and guiding us to organize this national webinar. I would like to thank Dr. Avinash Jadhav sir and Dr. Asmita Bhadre madam for helping us in the conduction of the webinar smoothly. Also, I thank to all participants UG and PG students, teaching staff, medical officers, and practitioners for participation in the today's webinar. Thank you one and all.
Madam, your voice is not audible.
Hello. Hello.
Yes, ma'am. Please proceed.
कुठून ऑडिबल नाही होत.
ठीक आहे, conclude करा मॅडम, काही नाही.
Okay, with this, I conclude today's webinar.
One announcement, short announcement is there for the participants. Feedback link has been shared in the YouTube chat box. Please send the feedback form so that e-certificates can be generated. For today's webinar, e-certificates will be generated immediately. So you will get your e-certificate in your email within 10 to 15 minutes. Please check your inbox as well as your spam folder. If it is in spam folder, please make it not spam so that future e-certificates will be landing in the inbox. Also, if you are checking from the mobile device, please refresh your spam inbox so that spam folder can be refreshed and your certificate will be seen there. Thank you for joining us.
Thank you all of you for joining us in today's webinar.